Hi, my name is Danae Mucher. I'm a student nurse practitioner at UTA. This is for Pediatric Assessment Lab, and I am presenting anticipatory guidance for a 6-month-old. There are many things that your pediatrician will evaluate on your baby's 6-month-old well visit. To start, they're going to check for certain developmental milestones. They're going to measure and weigh your baby and check if their growth is on track. They're also going to observe their development and behavior and perform a physical exam. They're going to check developmental milestones with physical skills. They're going to see if they roll both ways, if they're sitting up without the support of your hands on them. They want to see if the baby can support their whole weight on their legs. They want to see if the baby is reaching with one hand, transfers objects from hand to hand, and then uses a raking grasp. They're going to check for social skills. They're going to see if they enjoy social play. They may be interested in themselves in the mirror. They may respond also to expressions of emotions, and they want to make sure that there is a joyful appearance to them. They're going to check for things in cognitive thinking as well. They're going to see if the baby looks for a partially hidden object. They're going to see if they explore with their hands and mouth. They're going to see if they struggle to try to get that object that's just out of reach. Ways that you can help your baby with developmental milestones, with cognitive thinking, are reading to them and playing with them. You're going to have a lot of growth with feeding at 6 months old. They're going to see if solid foods have been started yet. This is a good time where you can ask if you're having issues with starting solid foods and maybe things your baby does or doesn't like. This is also a time when you can start water at 6 months, so your baby can start practicing with the sippy cup. During your child's 6-month-old visit, there are many immunizations and screenings that are done. The third dose of various vaccines are due, including rotavirus vaccine, diphtheria, tetanus, and pertussis vaccine, Haemophilus influenza type B vaccine or HIB, pneumococcal conjugate vaccine or PCV, inactivated polio vaccine or IPV, and hepatitis B vaccine. This is also the first time that your baby can get the influenza vaccine. Your doctor may do a few screenings. First, they're going to see if your child has had their first tooth. When they get their first tooth, they can apply a fluoride varnish to prevent any infections and tooth decay. And this can start at 6 months of age. They're also going to screen for postpartum depression. They may ask questions like, how are you feeling after the baby? How is feeding going? Are you or your partner having issues? You can ask them questions and they can give you resources. Thinking about the safety of your child is extremely important. At 6 months of age, they're starting to roll, sit up, and they're starting to become more mobile. This is a very important time to start childproofing your house. This is going to be doing things like making sure your cleaning supplies and chemicals are out of reach, personal hygiene products, any medications, small items, and button batteries. Make sure these are up and out of the reach of the infant. Also, it would be helpful to know the number to poison control, and obviously if there is an emergency, you need to take them to seek medical care. Young children 6 months to 3 years are the highest risk for choking. It is really important to know what to do in the event of a choking emergency. It is also really important to know that your caregivers are on the same page with you as far as foods. It's good to go over the types of foods the child can have, the safe foods, as well as what to avoid, and to also educate other caregivers of having these hazards up and out of the baby's way when they're starting to be a lot more mobile. Here are the references I used for my anticipatory guidance for a 6-month-old PowerPoint. I hope that you learned a little bit about important educational moments for parents of 6-month-olds, as well as feeding, developmental milestones, and things they may come in contact with at the pediatrician. And so they're educated and ready to care for their 6-month-old. Thanks.